Hi, my name is Lisa. Today I'm going to talk to you about developmental trajectories in infants at risk for autism spectrum disorder, or ASD. What is ASD? People with a diagnosis of this neurodevelopmental disorder experience difficulties in two broad domains. On the one hand, the social-communicative domain, and on the other hand, the domain of restricted and repetitive behaviors.
What you looking at? Can you look at mommy? Hey, come here.
That's a small example of a child with deficits in the first domain. ASD is mostly diagnosed in children over the age of 4. Little is known about the years before these clear behavioral symptoms occur, because at birth we can't differentiate which children will go on to develop ASD and which won't. In my PhD, I would like to look at the different developmental trajectories infants and toddlers go through while they grow up, so before being diagnosed with ASD. We investigate this in a high-risk population, where we include a group of siblings, a group of children with feeding and eating problems which aren't sufficiently explained, and a group of prematurely born children, because the prevalence of ASD is higher in these three groups than in general population. The children who are included will be followed from the age of 5 months to the age of 36 months, or 3 years, and will undergo several tests. After 3 years, we allocate them to either a typically developing group or to the group that fulfills the ASD criteria. After that, we can compare our results between these two groups. My work is part of the TIARA project. TIARA is an acronym that stands for Tracking Infants at Risk for Autism Spectrum Disorder, and this is a multidisciplinary collaboration between the KU Leuven and University of Ghent. Different aspects are investigated in the TIARA project by different PhD students. Within this larger framework, I will focus on eye tracking and electroencephalography. I will also look at the ADOS outcome, and ADOS stands for Autism Diagnostic Observation Schedule. So why is it important to investigate all these babies? If we can find a measure that makes diagnosis at an earlier age easier and more reliable, we can give parents and children the support they need. This way, the available resources can first be allocated to the children who need it the most. These children and their parents can benefit from early intervention, which leads to a better outcome. It promotes development and reduces risk of secondary problems of ASD, like social problems, anxiety, or acting out behavior. In short, I am investigating developmental trajectories of infants at risk for ASD to find a way to differentiate between these children with a risk of this neurodevelopmental disorder at an earlier age, to be able to support them as soon as possible so they can grow up to be the best version of themselves. Thank you for listening.